just, we're delighted, myself and Yvonne are delighted to be here tonight, especially on International Women's Day. And what I was just outlining is that there are 5 gynecological cancers. There's ovarian cancer, uterine cancer, cervical cancer, vulva cancer, and vaginal cancer. And worldwide, we see about 1.3 million cases of gynae cancers annually. And the majority of these are cervical cancer. And this is because there's an increase, I suppose, from the third world countries who don't have vaccination and screening programs for cervical cancer. Then it's followed by ovarian cancer, 23%. Endometrial cancer is one of those cancers that's on the rise because of its association with obesity. And then you have vagina and vulvar cancers where we have less than 5% of those we see worldwide. But in Ireland, we see about 2,000 cases of gynecological cancers annually. So when we look at those numbers, I suppose there's a lot of women needing support out there. And I suppose tonight we'll just outline some of the things that we've been working on in terms of raising awareness of gynae cancers and just letting people know of the supports that there are out there. No, we're going back the way. Let's see. Yeah, perfect. So this slide just highlights, I suppose, the different symptoms that are associated with some of the gynae cancers. And this is part of, I suppose, the message that we put out there when we're doing awareness campaigns, just to let people know it's persistence of these symptoms that people need to get checked out. So if you have any of these symptoms and they're lasting for 3 weeks or more, then you need to get it checked. And there are various symptoms associated with each cancer. And it's not only those, there'll be rarer symptoms that people will experience also. But this is kind of a nice slide to kind of summarize the 5 gynae cancers. And you see, for the likes of ovarian cancer, you see that, bloating and feeling full quicker, they're common symptoms associated with ovarian cancer. Uterine cancers, I suppose, fortunately, a lot of these cancers are diagnosed early because they present with bleeding, abnormal bleeding. So a lot of people will go to get an abnormal bleed checked. And that's why, I suppose, uterine cancers can be diagnosed early. The vaginal cancers and vulva cancers, some of these may be associated with HPV, and we might see a decrease in these over the next few years as vaccination takes effect as well, because there are some of these are associated with the HPV virus, which causes the majority of cervical cancers. And as we know, the World Health Organization has called for the elimination of cervical cancer, because through screening and vaccination, we should be able to get rid of this cancer in the next number of years. So hopefully in a few years' time, we'll be saying there's 4 gynae cancers and not 5. But there's a long way to go yet in terms of screening and ensuring that vaccination is taken up by people. So what I wanted to talk to you, I suppose, a little bit about was, a network that we have, and Jacqueline and her group are involved in this also. And we've called ourselves the Irish Network for Gynecological Oncology. And we really try, I suppose, advocate and increase awareness of gynecological cancers across Ireland. And we have over 30 groups now involved in this network. And my mission is to have a dot on every county in Ireland. So that's what we have to work towards over the next while. We have a lot of representation in Dublin, but we're fortunate that we have the support of the Irish Cancer Society, Breakthrough Cancer in Cork, and the National Cancer Control Programme, and the hospitals are on board on this as well. So it's all about getting our messages out there, and I'll tell you a little bit about the 2 days that we work hard on getting the message out for gynae cancers. So we have World Ovarian Cancer Day that takes place on May the 8th every year. And their mission this year is No Woman Left Behind. So it's to kind of get the message out about ovarian cancer to as many women as possible. We also work with a group in Europe who started a Gyne Oncology Day to increase awareness of gynae oncology, and that happens on the 20th of September. So the ovarian cancer is associated with the colour teal, the gynae cancers is with the colour purple. So you'll notice, I'm sure, that this centre lights up in teal and purple for these nights every year. So so people, as time goes on, people will become more familiar, I suppose, with the colours associated with these cancers. So this is just some of the work we did last year, and I suppose we were limited by COVID really, and not being able to have face-to-face meetings like we're able to do tonight. But we have a number of buildings that light up in teal across Ireland, and we also had, you know, online seminars. We had a Light Up in Teal campaign on social media, and we were all promoting this same message, the BEAT campaign, so for ovarian cancer: bloating, eating difficulties, abdominal pain, toilet changes. You know, if it's persistent, then go to your doctors. So there was a large study carried out by the group that organised World Ovarian Cancer Day, and they surveyed over 1,500 women who had ovarian cancer, just to see, I suppose, you know, what issues people had in their pathway to diagnosis. 44 countries were represented in this survey, including Ireland. Lots of different languages and lots of doctors involved throughout the world, really. And what they came up with was, while we know more research is needed in terms of improving outcomes from ovarian cancer, they were just trying to see, what can we do now, you know, for people that are diagnosed with ovarian cancer. And they came up with 6 global goals. And this is the message that we work with when we're working on the World Ovarian Cancer Day. And this is like, you know, that ovarian cancer must become a global priority. So it's really getting it out there, getting the message out there. That people have access to rapid diagnosis, because we know from that survey that it took almost 6 months for a lot of women to get their diagnosis for ovarian cancer. And this is because the symptoms can be vague, and they can be associated with like irritable bowel syndrome and other things. So it's really, if symptoms are persisting, go get it checked. Irritable bowel rarely starts for the first time in your 50s. So they're just some key messages to get out there. Family history is important. So it's important for women to tell their GP if there is a family history of cancers, such as breast, ovarian cancer, pancreatic cancer, endometrial cancer, because that may impact as well on your diagnosis. Data improvement is a goal. It's not really for Ireland. We have a good national cancer registry which captures all of the cancer cases across Ireland, but for other third world countries, you know, they want to work towards everyone having improved data. And then information and support. So for those that are diagnosed, providing information and support, and, you know, letting them know where to go for information. The World Gyne Oncology Day is more recent, I suppose, 2019, whereas the ovarian cancer started in 2013. And again, it's about, you know, they light up in purple and get messages sent out. And this year, I suppose, the message was all about communication. And again, we got our buildings to light up. And this is very effective for social media and getting the message out there. And also, what we did this year was we did a Dare to Ask campaign. So it was all about communication and encouraging women to ask questions. And we sent out to all our patient groups, you know, what questions would you like to ask now that you were too shy to ask or too afraid to ask when you got your diagnosis? And we had a number of topics came back. And what we did was we did a podcast series. And I'd encourage you to listen to these if you're out walking with your earphones. But it's on the Answers for Cancers podcast. And it's a very good series. But they ran, you know, because there was so many questions, they actually ran a little mini series. And we had 4 podcasts with answering all the questions. So various consultants and genetics. Karen Cadu is a geneticist. Helen Greeley is from here in Galway. She's in Cancer Care West. She took all the psychology questions. Donald Brennan took all the questions about surgery, and then Louise Comerford took all the nursing questions. So these are just all the questions that came in from patients, and they were answered by the various doctors. So that was very successful and got a lot of listenership on social media. Yvonne is going to talk to you about This Is Go, a platform, an information platform. And so I won't steal her thunder, but she'll explain all about the information that's there for women on this platform. But that was launched on the World Gyne Oncology Day last year also. I'm involved in a charity called Ovacare, and it's a support charity for women diagnosed with ovarian cancer. And I've been involved since 2011 with this charity. And what we do is, I suppose, we organise patient days, and we get the experts in to speak and give an opportunity for patients to ask questions. We have an online forum where people can talk to each other. And once a month, we run a coffee and chat. So similar to what you're doing here now tonight, we do it on a Saturday morning from 11 to 1. So, you know, and we have a group of women that have been diagnosed with ovarian cancer. And it's just often, I suppose, you hear from women, oh, I never met anyone that had ovarian cancer before. And that's very common because there's 400 cases in Ireland every year. So it's not a common cancer. It's not like breast cancer where we have over 2,000 cases every year. So this was an opportunity for women to talk to other women that are going through the same, and just to share their experience. And, you know, some might have tips with chemotherapy, and lots of different things get chatted about. And we usually have someone in to talk at the beginning of these. It might be even a yoga session, a chair yoga session. It might be a research talk, you know, for half an hour before the ladies get to chat amongst themselves. As I said, we do the patient days. We haven't gone back to those face-to-face, but we rotate those around the country. So we've had them in Galway, we've had them in Cork. We've had one we were about to do one in Sligo, I think, before lockdown, and Donegal. We were hoping to reach out to Donegal. We've had them in Limerick. So we move them around the country and get local speakers in to talk. And we play a big role, I suppose, in all the awareness campaigns and advocacy. And we have also been we've also worked with Yvonne and her group in terms of the This Is Go platform, and we've done some other research projects with Cancer Trials Ireland. So the ISGO PPI group then, and Yvonne will tell you how this fed into the This Is Go platform. This is a group Yvonne and I set up as part of the Irish Society for Gyne Oncology. And when I say PPI, it's public and patient involvement. So what does that mean? We wanted to create a partnership with patients to hear their voice in research, to let them direct some of the research that needs to be done. We wanted to listen to patients and see what might improve, you know, their disease trajectory, their experience. And so this group was set up in 2016. I think we had our first workshop, and we've done a lot since, and lots of groups have come to us looking for patients' input in different things. So the National Cancer Control Programme would have come to us to look for patient voices on their guidelines committee. And, you know, the group has been involved in research projects. We have had people come in and present research projects, and Jacqueline has been involved in that also. We're also part of the European arm of the European Society of Gyne Oncology, and we get a lot of tools and resources from them. And, you know, there's a lot of sharing of resources. So we'll bring back whatever we think might be useful, I suppose, to the Irish population. So if anyone is interested, we'd love to have more voices in this group. And really, we're about improving, I suppose, improving things for patients, and to bring about change and to shape policy, and wherever we can make a difference. But Yvonne will tell you the role that they've played a huge role in the This Is Go platform. So Yvonne will talk about that. Just mentioning, I've mentioned there, I suppose we've had people sit on the National Guidelines Committee, research projects. We're a member of ESGO Engage and also a member of ECPC, which Jacqueline also works in, the European Cancer Patients Coalition. We're involved in advocacy, and we're involved in that network that work on awareness. Also, the Irish patients have taken part in European-led surveys, and you know, we have data from an Irish population in that. And, you know, I suppose one of the most important things we've done within the Irish Society of Gyne Oncology is had the Laura Brennan Award for public and patient involvement. And, you know, we see here Laura received the first award. We had Joan Moore received it the second year. And of course, our own Jacqueline received it the third year. And then Kim Hanley has received it this year. So this has been, you know, it's really to, I suppose, to mark and to, it's a mark of achievement, I suppose, for those that do get involved in public and patient involvement and play a role in research. So we're delighted with this award, and it's a real achievement by the Society, and we have the backing of all of the Society in this. So, and I think that's my part. I'm going to hand over to Yvonne now to talk about the This Is Go platform.